This is episode 15 of Hat Talks with Arch. First, I'd like to share the sad news that the subject in my maiden podcast, He's 80, should be continued. Major Ramachandran finally passed away peacefully a few weeks ago at the age of 93, 13 years after the episode that was narrated. So let me doff my hat and maintain a moment of silence in respect of a fine gentleman who was also an accomplished artist. Welcome back. This episode is an ode to the doctors of yore entitled Medical Diagnosis, HI versus MI. In this episode, I discuss a few personal experiences and thoughts on the subject and will leave it to you listeners to dwell and ponder on. My father was a doctor and commissioned into the Army Medical Corps in 1949. He would have been 102 this year. But this episode, while not about him, starts there for me. After his commission, he joined the Indian Navy, and while he was probably the first doctor in the AMC to specialize in aviation medicine, he was also considered the local GP to those around him when not at work. I recollect people visiting the doc, as he was referred to, when there were medical issues, and while he'd listen to them, I could see that his brain would be busy scanning, interpreting, and diagnosing while examining the patient. Thereafter, pointing them in the right direction of either treatment or a specialist. Do you recall those days when, irrespective of the complaint, that one went with the GP with their coats, a stethoscope on their necks, always went through a standard, thorough examination that was routine and systematic? The patient would be sat down on a compact swivel stool less than an arm's distance away, and while engaging in discovery, the pulse would be checked with an occasional glance at the wristwatch while the GP's brain was working. Next, the eyes would be checked, pulling the lids gently up or down. The throat would follow using a tongue depressor and a torch. One would be required to mouth an ah. The steth is then used, and your lungs and heart are listened to from both the anterior and posterior. The swivel stool worked. And finally, one would be asked to lie down, and the abdomen palpated. The doctor by then had a good idea of the patient's general health, psyche, and well-being. Treatment was prescribed based on these parameters. The instruments used were fingers, a wristwatch, a stethoscope, a tongue depressor, and a torch. It was touch, feel, and diagnose. Sometimes they might have used the good old mercury BP instrument or a sphygmomanometer. That was standard examination, clinical diagnosis, and HI, human intelligence at work. Is that even taught in medical schools today? At the age of 12, the dentists at a naval hospital in Bombay, after a clinical examination, suggested to my father that several teeth in both my mandible and maxilla required to be extracted to make place for the wisdom teeth that would follow, as my jaw was too small to accommodate 32, and it would avoid the discomfort of double teeth later, as they called it those days. And so during the holidays, I was put under GA and the extra teeth extracted. There were no preceding tests, x-rays, etc. that I recall. It was a simple dental clinical diagnosis which left me comfortable in the ensuing years. In 2002, my GP in Bangalore was a retired officer from the AMC who I approached for the frequent headaches I was getting, and after several GPs had dismissed me saying that my BP was normal. After the routine examination, a sphygmomanometer, a stent, and a few questions later, he diagnosed that it was an elevated diastolic that was the cause, and I was prone to hypertension and prescribed some light medication only because the frequency of the headaches at the time was over 3 times a week. No ECGs, no blood tests, nothing. 24 years later, I am still medicated. Fast forward to today, and whether it's a simple cold, bronchitis, an unexplained pain anywhere, more often than not, the patient is first directed to do a CBC, an LP, RP, CAP, TSH, X-ray, USG, etc. Some or all of them to assist the doctor diagnose. If things are still unclear, it could be a CT scan, MRI, and many other tests with many abbreviations. There is little touch and feel. There is little HI at work, is my personal take. The new breed apparently requires MI or machine intelligence to help diagnose. Recently, in conversation with a young doctor who thought me very unfair to the young when I mentioned that I was more comfortable with doctors who were older and at least above 50 years, my reasons were experience, clinical diagnosis, and not subjecting patients to unnecessary tests and medications. My go-to doctor in regular life is a septuagenarian today, but been an old friend for over 40 years, and so far always right in his clinical diagnosis, purely by examination and getting answers to the correct questions that he puts forward. Thanks to him, among many issues, I discovered the habitation of the Heliobacter pylori or H. pylori bacteria in my gut. I also discovered that the wonderful sounding term of meralgia parasthetica was apparently the nerve condition that was bothering me. In all cases, the diagnosis was correct and treatment specific and effective that gave me immense relief. No extensive blood workouts, tests, or scans. So clinical diagnosis still works if applied correctly. More recently, I discovered some bright red blood when clearing my throat on waking up. I mentioned it to the spouse who instructed me to see an ENT specialist immediately. For those listeners lucky to have spouses, you will know that nothing progresses in life until you leave to see the doctor. I normally like to ponder, think, of course, Google, wait for a few days, bounce it off the friendly doctor before acting. But I have a spouse, and before my reluctant departure to see an available ENT specialist, I told her that the doctor would only prescribe an antibiotic, a hemostat, and would ask me to get an X-ray, possibly a scan, and a whole lot of blood and other tests. Nonetheless, I rushed out as the spouse had that look. The younger doctor sat me down about a meter away, asked some questions, switched on his miner's lamp strapped to his forehead, asked me to open my mouth, and then, with my tongue out, say, "Ah," while he peered from a meter away. That was it. And then the prescription included all my predictions except the scan. The skeptic that I am allowed me to take the antibiotics as a precaution and nothing else. I was normal from day 2. As a senior citizen, about 6 to 8 months ago, when I was having focus issues while reading with my glasses on, an apparently reputed ophthalmologist was recommended and an appointment made. I was initially run through some routine tests using fancy machines, including intraocular tonometry by an optometrist. Then I had to wait indefinitely for the ophthalmologist with whom the appointment was made. That didn't happen as he was apparently busy. So I had to settle for his offspring, who looked at the reports and said, "All is well," and that I had early signs of cataract, but not to worry, sir. I was somehow not comfortable with either the examination nor diagnosis, and so sought an appointment with another septuagenarian friend and ophthalmologist. I was transported back to the old times. The examination and checks were routine, systematic, and thorough. Eye and reading tests with charts and a card. An old-fashioned tonometer used to check my intraocular pressure, and he proceeded to dilate my eyes. Thereafter, a thorough check with an ophthalmoscope when he detected some sort of grit on the surface of the eye and asked if I had dandruff. I didn't think so, but it got me thinking. The verdict: my eyesight was better than normal with the glasses, and I was prescribed an eye drop to be used for 45 days and to revert. No early cataract was detectable. I felt good with my examination, and 30 days later, with the drops and an anti-dandruff shampoo thrown in for good measure, I was fine and with full focus. Incidentally, both the septuagenarians doctors I mentioned were ex-AMC or Army Medical Corps. My brother-in-law died young in horrendous circumstances only because the duty doctor failed to diagnose fast-spreading diphtheria and perform a tracheostomy, an emergency procedure that even ship's masters and paramedics are trained to handle. So my question is, as we generally head for Google when we cannot recollect data, thereby reducing our recollection abilities, are the present-day doctors relying more on machine intelligence? Are they letting their diagnostic skills rust due to the lack of usage and over-dependence on MI? Are their synapses weakening due to this transition? Or is everyone just playing safe and in the bargain forgetting their skills and thereby their roles? Where is this heading? With robotic surgery, machines to diagnose, lab tests to analyze, will doctors only be endorsing prescriptions offered by machines? Will MI finally trump HI? Totally? If so, will there be a time in the future when we will be looking for those with human intelligence skills which by then will be in short supply? It's something that worries me, and it should the younger medicos, the next gen, and the patients or customers as I call them. Leaving you with these thoughts until the next time, while you remember to like, to share and subscribe. This is captjun signing off.